A look back at how COVID-19 impacted Southeast Asia this year and left not just death, but also hope in its wake. In mid-July, Indonesia experienced the kind of devastation from COVID-19 that India had just a few weeks before. The Delta variant tore through the country, making it the epicenter of the pandemic in Asia. At the time, Indonesia had fully vaccinated less than 6% of its population. As a result, 1 in 3 people were testing positive, with many ending up in hospitals. DW went behind the scenes at one such facility to see firsthand how healthcare workers struggled to keep the system from complete collapse.
Getting into her COVID protective gear takes some time and more than a little courage. But Nurse DeSanti is just glad to have equipment available. Right after graduating from nursing school last year, she was sent to the front line of the pandemic in Jakarta and became infected herself. A few months after she recovered, the second wave hit the country.
We used stretchers, wheelchairs. We even had to rotate the oxygen bottles for patients in the emergency room. And they kept coming and coming, even after we were out of beds and oxygen. Those who came had low oxygen levels. I was overwhelmed.
Officially, COVID has claimed more than 100,000 lives in Indonesia, with many health workers among the victims. They've mostly been given the Chinese Sinovac vaccine. Now, medical staff like Dr. Puspita are getting a booster shot of Moderna to better protect them.
I'm really tired. This is just me, but when there are a lot of cases, I start talking to myself. This is insane. I have to work with COVID-19 cases over and over. I often feel like crying, but then I realize I'm not alone. My colleagues are also working hard.
But by October, Indonesia had passed the peak of infections, but people were still dying, many alone in their homes. It fell upon volunteers to step in and organize funerals for these victims of COVID-19, if only to give them some peace in death.
Antonio Sayano puts his life on the line, caring for the dead. The 53-year-old is a member of a so-called quick burial team, one of the many COVID-19 volunteer groups in the city of Yogyakarta. Their motto is, People of Johor District, we are responsive, agile and tough. The volunteers help overwhelmed cemetery officials to deal with the many COVID-19 victims in Indonesia. Despite much lower case numbers in recent weeks, their help in this part of Java is still needed.
I am suffering from all the heat and all the sweat. Sometimes the funerals process is entirely in our hands because the others are afraid.
It's not just that some people are afraid. Many grave diggers are simply exhausted and can no longer, for instance, collect bodies from people's homes. During the peak of the pandemic, graveyards were open around the clock. In July alone, 570 people died here, more than in the previous 12 months. Normally, Hayono works as a cleaner, but in the pandemic, people like him have prevented the entire system from collapsing. His family is proud that he volunteers, but they also fear he might get infected. The volunteers hope that the fast burial of bodies will not only bring down the infection risk and hence the mortality rate, but also help to reduce the psychological burden for mourning families. Hayono is a Christian and says he regards helping as a duty.
Is it a risk? Yes. We're actually a little afraid, but we throw that fear away and put our hope in the Almighty. It's great to help people in need and make sure things run smoothly and safely.
And with all the precautions in place, Haryano is positive that he can achieve this goal at the end of the day with a negative result.
In Myanmar, meanwhile, a double crisis pushed the country to the brink this summer. Political instability after the military coup and a brutal second wave of COVID-19. Thousands of healthcare workers had walked out in protest against the junta. The few hospitals that stayed open couldn't keep up with the strain. Many people turned to religious groups for oxygen to treat the sick.
It's just after dawn in Yangon, Myanmar's largest city. In front of this mosque, the line for empty oxygen tanks slowly shuffles forward. People have already been waiting for hours, desperate for a refill of medical oxygen for loved ones with COVID-19. If we want to get medical oxygen, we have to come here early. Even though I came here at around 4 in the morning, I had to stand back in the line as some people had already arrived. For many in Myanmar, treating COVID-19 is a do-it-yourself project. Oxygen and hospital beds are scarce. The mosque decided to offer oxygen as a way to help. Initially, we thought of distributing meals to COVID quarantine centres like we did last year. But we changed our decision as we saw people in desperate need of medical oxygen. It's available here, free of charge. Religion, ethnic background doesn't matter. All who wait are served. It's a lifeline, as most people here can't afford to pay. Prices have more than tripled with the infection surge. The military government has not been able to effectively manage the health crisis. Authorities are now even forcing oxygen factories to close, so we're struggling to get enough supplies to refill the oxygen tanks. At public hospitals, there aren't enough medical facilities, and they're finding it hard to cope with the demand for oxygen and other essential drugs and equipment. With the country in crisis, these Muslim volunteers say they want to join with the Buddhist majority in the fight against COVID-19. And many in need are taking up the offer, since they have nowhere else to turn.
In Malaysia, the pain of loss was still fresh during August, the month of the Hungry Ghost Festival. Buddhist and Taoist families traditionally take this time to honor the dead with gifts. And one religious shop owner came up with an item that many had wished to give departed loved ones.
Mr. Leong makes the jab many departed loved ones never got: COVID-19 vaccines. Except these doses are made from paper. Devout families are buying them up as gifts to appease the spirits of the dead.
The COVID-19 situation in Malaysia is quite serious. Many people died before receiving the vaccine. Therefore, I hope with this product, it can help the deceased to fulfill their dying wish.
The heartache over vaccines is high this year. Thousands in Malaysia have died before getting the chance to get the jab. Mr. Leong can barely keep up with demand for his paper sets.
The orders keep coming, and we have to work overtime until late at night to make this product.
Families who've bought the paper vaccines will, in the end, burn them as offerings during the Hungry Ghost Festival, when spirits are thought to return to Earth. Though this vaccine couldn't prevent the death of loved ones, many hope the gesture will at least bring them peace in the afterlife.
Another place where COVID-19 has taken a heavy toll is the Thai capital, Bangkok. Among the many who died were some of the owners of the city's well-known street food stalls. And as we report, some of their children are stepping up to the plate to make sure their businesses continue to thrive.
It is now one of the first things Adalwich Tangsubmani does when setting up his food stall. Alongside the Michelin stars, he places a photo of his father, who died this year of COVID-19. He ran the stall for nearly 50 years, turning it into a must-visit of the Bangkok street food scene. For Adowich, there was no doubt he would continue serving up the stall's renowned rolled rice noodles. I have to continue this business. This shop was what my father loved the most, and I love him the most. I have to keep it going, no matter what. Stalls like this one in Bangkok's Chinatown were under threat even before the coronavirus pandemic, facing competition from upmarket restaurants and resistance from city planners wanting to clean up the crowded pavements. But some say you can't beat these gastronomic gems, handed down from generation to generation.
This noodle stall has existed for so long, since when my mother and my aunt were young. People know that it is famous. When they come to Chinatown, they know that they have to come and eat at the noodle stall under the old cinema building.
It's why Sarisa Saitang keeps on going. Her mother was another well-known street food vendor who died of COVID. Sarisa's had to learn quickly how to make her mother's favourite duck stew.
I'll be overjoyed if customers say our duck still tastes like my mother's. It's given me some encouragement. Some tell me not to quit because they can't find food like this anywhere else.
And so, in this corner of Bangkok, street food is now more than just about its taste. In the time of COVID, it's about keeping memories alive.